Welcome to the Relief Neuropathy Centers. This video provides information about relief therapy for peripheral neuropathy. Relief Neuropathy Centers use specific tools and tests to evaluate the extent of nerve damage. We use the same tools and tests to measure improvements after you start relief treatments. Our tests are standard neurology tests that ensure we are making headway in accomplishing your therapy goals. The Patient Symptom Survey gives us specific information about your current symptoms, symptom severity, and the area of your body affected. You'll complete the Patient Symptom Survey at the beginning of each treatment visit. A quality of life survey tells us how peripheral neuropathy affects your normal daily activities. The balance test shows us how peripheral neuropathy is affecting your balance. The pinwheel test measures the extent of small diameter sensory nerve damage, the damage that causes pain, burning, cold, or electric shock sensations, or oversensitivity to touch. The tuning fork measures the extent of large diameter nerve damage, the damage that causes numbness, tingling, loss of balance, or loss of reflexes. The pinwheel and tuning fork tests typically reveal that the area of actual nerve damage is larger than the area of neuropathy symptoms. For example, if a patient reports symptoms from their toes to their knees, our tests usually show that nerve damage has progressed to mid-thigh. Our tests allow us to objectively evaluate your nerve function, independent of your current symptoms. The Relief System recommends an acute treatment plan based on your symptom report and results of the pinwheel and tuning fork tests. The plan includes the number, frequency, and duration of treatments. The Relief System adjusts your treatment plan at each visit in response to symptom changes and test results. Therefore, each patient's treatment plan is unique to his or her specific presentation at each office visit. Relief therapy is a form of light therapy, delivered with a Class 4 therapeutic laser. The red aiming beam is used to guide therapy delivery. Another invisible beam delivers laser light, which stimulates the restoration of nerve function. The laser therapist holds the laser beam above your skin and paints the affected area. Most patients don't feel the laser beam, though some report a feeling of gentle warmth in the area being treated. During treatment, you'll sit in a comfortable chair in one of our treatment rooms. The Relief System meets all safety standards, but since the eyes are sensitive to invisible laser light, we'll ask you to wear protective glasses during treatment. Each patient's response to relief therapy is different. In general, sensation is restored in the opposite direction as loss of sensation. So if your peripheral neuropathy began in your toes and gradually progressed to mid-thigh, more normal sensation will be restored to your mid-thigh, then to your knees, legs, ankles, top of your feet, over the ends of your toes to the balls of your feet. Small and large diameter nerves may return to more normal function at different rates. As nerve function improves, patients may experience recovery sensations. These sensations are much like the tingling experienced when your hand wakes up after falling asleep. Peripheral neuropathy is a chronic disease. The relief treatment protocol includes acute treatments to reduce your peripheral neuropathy symptoms, followed by maintenance treatments to minimize the chance of recurring symptoms. All treatments in both the acute and maintenance phases are based on the results of tests performed at each office visit. Many patients require fewer maintenance treatments over time. Keep in mind that the relief therapy addresses the symptoms of peripheral neuropathy. Our treatment protocol also includes stretching and strengthening exercises to restore muscle function. These exercises are performed by patients between visits and are essential for improving quality of life. Many of our patients have medical conditions unrelated to peripheral neuropathy. Common examples include arthritis, gout, swelling, vascular problems, or other medical conditions. These conditions require the continued attention of specialized healthcare providers. To achieve your therapy goals, it is important to seek treatment for all medical conditions that affect your quality of life. Relief Neuropathy Centers support their patients throughout the recovery process. Patients who actively participate in their own care achieve the best therapy outcomes. We'll ask you to take an active role by reporting your current symptoms at each treatment visit, reporting all therapies you have used or are currently using to treat peripheral neuropathy, and following instructions for stretching and exercises between treatment visits. We believe the symptoms of neuropathy should not define your life.